Welcome. This presentation will give you a brief overview of the new Pediatric Surge Toolkit. All resources discussed here are available to the public on the Minnesota Department of Health's website. Let's get started. At the end of this brief presentation, you will know the types of resources available to you in the Pediatric Surge Toolkit and understand how to use the toolkit. There are 5 different types of resources in the Pediatric Surge Toolkit. They are assessment tools, planning tools and templates, education and training tools, exercise tools and templates, and response tools. All of these tools cohesively make the Pediatric Surge Toolkit. Before you plan for a pediatric surge incident, you must first assess where you are. The assessment tools consist of a PowerPoint presentation, complete with a facilitator's guide, to start a conversation about preparedness and planning at your facility or region. Additionally, there are checklists designed both for individual healthcare facilities and regions, like regional healthcare coalitions. These tools will help you determine where you are in the planning process. What do you already have in place, and what do you still need to do? We advise that anyone using the Pediatric Surge Toolkit start with the assessment tools to give yourself a strong foundation in the planning process. The planning tools may look familiar to some of you. The Pediatric Surge Primer has been updated and slimmed down. It is a great resource for all hospitals and healthcare facilities for basic considerations surrounding pediatric surge preparedness, including staffing, training, equipment, and logistics. In addition to the primer, there is also a template plan inclusive of job action sheets. If your facility needs a pediatric surge plan or appendix to your current emergency operations plan, you can download the Word documents from the website and make them your own. There is also a sample menu to assist in your planning. If your facility should lose electricity during a disaster, the menu provides easy-to-make meals for children of all ages. The next set of resources are education and training tools. Here you will find the 6 educational modules pediatric experts in our state created. There are a few training scenarios for practitioners to work through, as well as a training matrix for all hospital staff, which outlines what level training staff should have in respect to pediatric surge. The 6 educational modules are for practitioners, nurses, emergency managers, first responders, social workers, and others. They are about pediatric care, particularly during a surge event. They were developed after basic pediatric education was identified as a statewide gap in 2017. Each module stands alone, and they range in length from 8 minutes to 27 minutes. The topics are pediatric surge trauma, triage and decontamination, non-traumatic disaster, crisis standards of care, children with special needs, and operations and incident management. The 4th set of resources for use are exercise tools and templates. These materials will help you identify areas of improvement in your plans. Available to you is a presentation and facilitator's guide, tabletop situation manual template, pediatric victim cards, and pediatric scenarios for exercises. The final set of materials are response tools. Materials range from quick reference for triage, to handouts for parents and caregivers, to checklists for the facility and patient tracking forms. Some documents are in Word format, which enables healthcare facilities to add their unique contact information if desired. Thank you for taking time to watch this brief overview of the Pediatric Surge Toolkit. We hope you take time to explore all the materials available to you on the website. If you have questions, contact your local healthcare coalition or the Minnesota Department of Health Center for Emergency Preparedness and Response. Happy planning!